In Ethiopia, despite the significant improvements in expanding access to maternal and newborn health services, gaps in the provision of quality maternal newborn health services remain. In 2015, Federal Ministry of Health developed a national healthcare quality strategy emphasizing on maternal newborn health as top priority. The Maternal Child Survival Program community-based newborn care project supported selected health centers in quality improvement. Olgolcho Health Center is one of the health facilities that is benefiting from the Maternal Child Survival Program Health Center Strengthening Initiative.
This plan is focused on strengthening health centers by implementing a system for quality improvement. There is a checklist prepared by the Ministry of Health for this purpose. This project covers prenatal, delivery, and postnatal care. So we will explore what is needed for this health center to provide quality standard services.
To mention some of the steps that we follow in strengthening health centers for MNCH quality improvement. The first thing is doing consensus building with Warada Health Office and the Health Center performance review teams, and using the MNHQY tools. They will do their self-assessments, and then based on the findings of the self-assessment, they will develop quality improvement action plans to address some of the critical gaps that they have identified. And in these plans, they have specific actions, improvement ideas, and responsible people, and look for local resources to mitigate some of the gaps.
The project is also strengthening the capacity of selected high-delivery caseload health centers on the provisions of essential newborn care services and management of 3 major causes of neonatal illness and death. The approach enables health centers to assess their shortcomings and improve quality consistently. These health centers are expected to become models for the others. We have organized a team of professionals referred as the Performance Review Team to identify the service inadequacies. They meet bi-monthly. If we continue to do our best, we will not fail at addressing any obstacles. We previously did not have a waiting room for pregnant mothers. At our last meeting, we agreed to make one. We've opened a first-stage labor room for mothers who are in their last days of pregnancy. Even if they live nearby, they should never be sent back. Now we are able to admit them into our prenatal waiting rooms till they are ready to deliver.
In Olgolcho, we found them address critical gaps that they had at baseline. The use of parthographs for deliveries and labor was minimal, and we also introduced the use of safe childbirth checklists to improve on quality of maternal and newborn care services. The other critical gap that we have seen in Olgolcho was that labor and delivery rooms were not safe and comfortable, particularly in terms of offering privacy, alternative birthing positions for moms, including bed screens and others. Olgolcho Health Center also at baseline had a problem in availing the necessary equipment, supplies, and inputs for providing immediate newborn care services, which are critical to save the lives of newborns. And that's also one area they showed improvement in terms of availing newborn corners, making sure that all the necessary supplies and equipments are available and within reach for a midwife to resuscitate newborns that have needs, and also provide essential newborn care for every newborn delivered at that health center.
Here, my daughter-in-law checked in yesterday and delivered safely. Their treatment is very good. We felt at home.
We used to go through many problems during delivery. They would carry us on long stretchers, and we were exposed to danger. Death on the journey was the fate of many.
In the process, a number of things have been realized, considering the encouraging success achieved in the provisions of quality health services. I believe we can use this health center as a pioneer for quality improvement.
I would say one of the successes that this project had in terms of spreading these experiences from the 30 model health centers we had was organization of the experience sharing events for other health centers in the same zones and waradas. And we have seen great improvement, great interest in the leadership of waradas and the zones to scale up these activities.
Quality improvement teams formed with community representatives. Regular meetings take place for quality improvement follow-ups. Cartograph's usage has increased from less than 55% at baseline to 91% at the last verification assessment. Facility cleanliness improved and supplies are available. Identification and management of newborns with complications improved. Rooms rearranged to meet standards and improve patient privacy and comfort.